One of the biggest scapegoats for your child's poor sleep is teething. I hear it all the time. Oh, sleep is great for 4 days, but they're cutting another tooth, or they're teething. Is this real? Is it a thing? Or can we really get it on track even though your child is teething? Let's talk about it. Hi, my name is Sarah, and as the lead certified pediatric sleep expert at Your Zen Baby Sleep, I hear this all the time, all about teething or other things that really affect our child's sleep. And I help guide families and teach them that it's actually not teething. It's not a thing, it's not affecting it. I am so excited to teach you all about teething and how to get your child's sleep on track today. All of the advice that I am providing today is from pediatric dentists. So I work with quite a few of them actually very closely in conjunction with my sleep business. And when I have been talking with pediatric dentists across the board, what they have said is that when our child is cutting a tooth, they are going to experience acute teething pain for about 2 to 3 days as the tooth cuts through the gums. Technically, from birth through getting their adult teeth, our children are always teething. So our adult teeth are constantly pushing down on our baby teeth to push the baby teeth out. And then when the baby teeth come out, the adult teeth are constantly pushing down. And this whole process takes over a decade before we receive our full set of adult teeth. So, long story short, teething is not the reason why your child has poor sleep habits overall. If your child is a solid sleeper, falls asleep independently on their own, sleeps throughout the night, takes really age-appropriate naps, length of naps are great, and they are cutting a tooth, it is totally possible that their sleep could be off during those 2 to 3 days of the tooth coming in. I want you to make sure that they are actually cutting a tooth and that you're not seeing symptoms that are unrelated to teething. So symptoms of cutting a tooth are, you're gonna see the gum gets a little swollen. You're gonna see a little hole at the top of the gum line, a little white tooth popping through. If it's a molar, it might actually look black and blue. So these are signs that your tooth is actually pushing through the surface. Some signs that are confused with teething, but aren't necessarily meaning that a tooth is popping through, putting stuff in your mouth. Babies learn primarily in the first year of life by putting things in their mouth. That is how they respond to their environment. It's how they explore. It's the sense that they use the most. So putting fingers in the mouth or picking up objects and gnawing on them is not necessarily a direct correlation to a tooth cutting. Can that happen when you're cutting a tooth? Of course. And does it provide pain relief? Absolutely. But your baby will likely be mouthing things for the majority of their developmental life until they move on to the next developmental step and they don't need to use their mouth as a mode of exploration. Drooling is another symptom that could be related to teething, but if your baby is drooling all of the time, it doesn't mean that they are always in pain from cutting a tooth. The takeaway from this is that when you have the mouthing and you have the drooling and then you have awful sleep and it's going on for weeks and weeks and months, the two aren't related. There is something else that is underlying your baby's sleep issues that aren't related to cutting a tooth or teething pain, and it likely is a sign that it is time to implement some type of sleep training or teach independent sleep habits so that your child is better efficient at their sleep skills. What if your child actually is teething though, and that is the specific reason why their sleep is off? Always make sure that you go to your pediatrician and ask for your pediatrician's advice, but this is when you can offer some type of pain relief medication such as Tylenol or Motrin. You can also go the homeopathic route and utilize the Camilla teething drops, something that can also calm teething down. And doing things during the day, such as offering them a teething ring that you put in the freezer that's nice and cool, that can help calm the teething pain or just help move the gum around to help the tooth pull through. Really, the name of the game as your child is cutting a tooth is just to keep them comfortable. If their sleep is off for more than 2 to 3 days, or if it continues to be off after the tooth has reached the surface, then I want to make sure that you're going back to basics, you're re-implementing your sleep rules, and feeling confident that your child didn't all of a sudden forget how to sleep well, and they need to be able to figure out the sleep on their own as they had been before the tooth was cutting. If this is mind-blowing to you and you're thinking, oh my God, it's never been teething, there's something else that I can do to help them with their sleep, this is exactly what I help families with every day. Head over to my website, yourzenbabysleep.com, to learn more about my one-on-one and group coaching packages so that I can help you get to the root cause of your sleep challenges and sleeping through the night. Let me know in the comments if you have any questions about teething in sleep or sickness in sleep, anything that can affect your baby's sleep. On your way down there, be sure to like this video to let me know that you've enjoyed the content, and subscribe to my channel so you are the first to know when I publish my latest and greatest sleep tips. As always, from my living room to yours, thank you so much for joining me today, and sweet dreams.